You've heard the term heart attack a million times, right? But do we really get what's happening inside our bodies when one strikes? Well, in the next few minutes, we're going to pull back the curtain on this critical medical emergency, from the silent buildup all the way to the race against time. First up, we'll get straight to the point. What is a heart attack? Then we're going to play detective and uncover the chain reaction that leads to one. We'll also cover the crucial warning signs to look out for, see what happens in that emergency race against the clock, and most importantly, talk about how we can prevent one from ever happening in the first place.
All right, first things first, let's get a really clear definition of what we're talking about. What exactly is a heart attack?
Okay, let's not beat around the bush here. A heart attack, or what doctors call a myocardial infarction, isn't some minor scare. It's a life-threatening emergency, full stop. It demands immediate medical attention.
So at its very core, a heart attack is basically a plumbing problem. Just think about it. Your heart is this incredible muscle, and it needs its own fuel line to get oxygen-rich blood. When that supply line gets clogged, well, parts of the heart muscle literally start to suffocate. They start to die.
And look, this isn't some rare one-in-a-million thing. Heart attacks are a major cause of death and disability all over the world. That's exactly why understanding them isn't just for doctors and nurses, it's for every single one of us.
So, the big question is, how does a perfectly healthy artery get to the point of a critical, life-threatening blockage? You know the really scary part? This whole process often starts silently, years, even decades before you feel a single thing.
Okay, so picture your heart as the engine in a high-performance car. And every engine needs fuel lines, right? For the heart, those are the coronary arteries. And the root cause of almost every heart attack is something called coronary artery disease. Basically, it's a disease where those fuel lines get clogged up. So, who's the main villain in this whole story? It's a process called atherosclerosis. Yeah, it's a mouthful, but what it means is that over time, gunk, stuff like cholesterol and fat, builds up inside your arteries, forming these hard things called plaques. It's kind of like rust slowly building up inside a pipe, making the opening narrower and narrower. And this is the catastrophic chain of events. It all starts quietly, with those plaques building up for years. Then, bam! One day, one of those plaques suddenly breaks open. Your body, trying to help, rushes to form a blood clot to patch up the injury. But here's the tragic twist. That helpful clot can become the final plug that completely blocks the artery. From that moment on, the heart muscle is starved of oxygen. That's called ischemia. And if that blood flow isn't restored fast, that muscle tissue starts to die, and it doesn't come back. Now, when that clot creates a total 100% blockage, doctors call it a STEMI. They can see a very specific, alarming pattern on an EKG. This is the big one, the most severe type of heart attack. It's what causes those classic dramatic symptoms you see in movies, and it is an absolute, sirens blaring medical emergency. But what if the artery is only partially blocked? That's called an NSTEMI. Now, the symptoms might not feel as severe at first, but don't be fooled. This is still incredibly dangerous because that partial blockage can turn into a full one at any moment. It still requires immediate hospital care. And then you've got the silent heart attack, which is maybe the sneakiest of them all. It causes real, permanent damage to the heart, but the person might not feel a thing, or might just dismiss it as indigestion or feeling tired. This is precisely why it's so critical to know all the warning signs, not just the obvious ones.
Okay, this leads us to what might be the most important part of this whole explainer. How do you know if a heart attack is happening? What are the distress signals your body might be sending you?
So, on one side, you've got the classic movie heart attack symptoms. That crushing chest pain, pain shooting down the arm. We've all heard of those. But please, I really want you to look closely at the other side. Atypical symptoms can be incredibly vague. Things like overwhelming fatigue, what feels like bad indigestion, or just a sudden, unexplained feeling of anxiety. These get missed all the time, but they can be just as deadly.
The second any of those symptoms are recognized, a clock starts ticking. Loudly. Every single second matters, and what happens next is truly a race against time.
Yeah, that clock starts with the very first symptom. The heart muscle, it's tough, but it can only survive without oxygen for about 20 to 40 minutes before the damage becomes permanent and irreversible. That's the window. That's why time is muscle is the mantra in cardiology. Calling for help immediately isn't just a good idea, it is the single most important thing you can do.
And treatment doesn't wait for the hospital. It starts the second paramedics walk through the door. They can give oxygen to help the struggling heart, aspirin to help thin the blood, nitroglycerin to try and open up those arteries, and even powerful clot-busting drugs that can start dissolving the blockage right then and there.
Once at the hospital, the team has one main goal: physically get that artery open. The go-to procedure is usually an angioplasty. Doctors thread a tiny wire with a balloon up to the blockage, inflate it to push the plaque aside, and often leave a little mesh tube called a stent to keep the artery propped open. Now, if the blockages are really bad or in multiple places, the solution might be bypass surgery, where they literally create a new detour for the blood to flow around the traffic jam.
All right, let's talk about the most empowering part of all of this. Because whether you're recovering from a heart attack or, even better, trying to prevent one from ever happening, you have more control than you think. So how do you take charge of your heart's future? First things first, you've got to know your risk factors. Think of it like a hand of cards. On one side, you have the things you can't change. Your age, your family history, your genetics, that's the hand you're dealt. But on the other side, you have the modifiable factors. These are the cards you can actually play. Smoking, high blood pressure, what you eat, how much you move, how you manage stress. These are the dials you can turn to seriously, dramatically lower your risk. And for anyone who's been through a heart attack, the journey back isn't something you do alone. It's a structured program called cardiac rehab. And it's so much more than just hitting the treadmill. It's a whole support system that gives you the tools for a healthier life. From medically supervised exercise to learning about nutrition, quitting smoking, managing stress, and making sure you're on the right medications to protect your heart for the long haul.
You know, when you strip it all away, it really boils down to this one simple truth. Modern medicine is amazing, no doubt. But the single best strategy, the winning strategy, is prevention. It's about taking control of your health today to stop a heart attack before it even gets a chance to start.
So, the big takeaway here really is a message of hope. Awareness truly is power. Knowing the signs, acting fast, and using the incredible treatments we have today makes a world of difference, not just in surviving, but in thriving afterward. So, I want to leave you with this one question. Now that you know the stakes, now that you've seen the whole story from that silent build-up to the frantic race for treatment, what is one single step, just one thing, that you will do starting today for the future of your heart?